this is so much more powerful than just a scale, because you could gain 5 pounds of muscle and lose 5 pounds of fat. A scale won't tell you that, but the InBody will. And so it does help with my patients buying into their treatment and seeing that their treatment is working. What some clinicians do, if they are doing like traditional insurance billing, which is a lot of what we do in our clinic, is they include the interpretation of an InBody as part of their medical decision making. So the way we bill is we're kind of like scoring, how much work or how much thought we had to put into the patient. And so medical decision making, like interpreting the results of an InBody, would count towards the complexity of a visit.
Welcome to Beyond the Scale. I'm your host, Bradley Davey. This podcast exists to educate and empower the next generation of healthcare providers. We're here to share powerful tips, tricks, tools, and resources to help catalyze your growth with InBody's ecosystem of health assessment tools. Today, we're going to talk about how body composition is applied in obesity management. Our guest today is Dr. Carolynn Francavilla. She's a board-certified family medicine practitioner and a diplomat of the American Board of Obesity Medicine. She owns and operates Green Mountain Partners for Health and Colorado Weight Care in Denver, Colorado, where she's nationally recognized as an obesity expert, lecturing to clinicians on topics of obesity, as well as teaching through her own platform, helpyourpatientsloseWeight.com. She hosts the Dr. Carolynn Francavilla Show, which is a podcast on weight and health. She's the founder of GLP Strong Fitness Program, assistant professor at Rocky Vista University, and serves on the board of the Obesity Medicine Association Board of Trustees, where she was awarded the Dr. Vernon B. Asler Award for dedicated service and support to the Obesity Medicine Association. Welcome, Dr. Carolynn Francavilla. Thanks for joining us.
Thank you so much for having me. I'm so excited to be here today and to talk a little bit about obesity medicine, talk about how InBody has impacted my practice, and see where this conversation goes.
Fantastic. We're excited to have you. So take me back. Tell me a little bit about, where did you develop your philosophy of care and interest in family and obesity medicine?
Yeah, I always like to say I was a little bit of a weird med student. I felt like I was an odd duck. I was very interested in preventing health problems. So, my classmates would be really excited when they got to see a very sick patient or go into a complicated surgery. And I was much more interested in, how do I prevent that? How do I keep people from getting sick? And I came into my medical training with a lot of interest in nutrition and physical activity and how those could help people. And that really solidified during my medical school experience when I saw how many people were struggling with type 2 diabetes, how many people were having cardiovascular disease and heart attacks, and realizing that there was such a role to prevent those things, that so much of what I was seeing could be prevented. And so I went into family medicine because family medicine has a very big emphasis on preventing medical problems. That's a big part of our training and what we do. And I was lucky enough to do an obesity medicine. It was called bariatric medicine back then, but an obesity medicine rotation as an intern. And I knew it's what I wanted to do with the rest of my life. I was able to see how we could leverage not just lifestyle, nutrition, and movement, but how we can often pair that with things like medications to really help people treat obesity and prevent all the complications that can go along from excess body weight. So from there, I just really didn't look back. I jumped right into obesity medicine as soon as I was done with my family medicine training. And that's been more than 10 years now. And the field has changed tremendously in that time period. But what we're really seeing is that we can do so much to improve how long people live and how well they live. And that's really my passion, is helping people live longer and live better.
Can you go into a little more detail on your philosophy of care and how that shows up today in your business as the different products or services that you offer?
I think that there's 5 components to what I do as an obesity physician. The first is looking at underlying causes. So to me, it's always been important to figure out why someone is struggling with their weight, because there are some universal things For example, when someone uses lifestyle, they use diet and exercise to lose weight, their metabolic rate is going to go down when they're losing weight, and their hunger and their drive to eat usually goes up. And that's why so many people struggle to have really long-term or really significant weight loss results with lifestyle alone, because their metabolic rate again is going down, hunger is going up. It starts to feel like a losing battle, and people think that they've lost their willpower when really physiology has taken over and made it hard for them to stick with that plan. But there's so many different things beyond that that contribute to any individual struggle. Some people have binge eating disorder. Lots of people have insulin resistance. Some people's microbiome might be, disrupted. People may have food security issues. People may struggle with alcohol abuse. There's sleep apnea that might be contributing to weight. Stress is a huge thing that contributes to weight. So trying to figure out each individual sort of pattern of why they're struggling, and when we can, addressing those specific issues. And then from there, utilizing personalized nutrition plans, personalized exercise plans, medications as appropriate. Usually if someone's coming to see me, it's because they've tried other things and they're ready to try a medication. And then behavior change, which is a really big term that can involve coaching someone, can involve teaching people how to log, can involve changing mindset around what is a healthy weight. That's a really big and dynamic component of what I do as a clinician, is trying to figure out how people can actually be successful at what they're doing. So those are the 5 components of what I'm doing clinically when I see someone.
So were those 5 components metabolism, exercise, nutrition, medication, and behavior change?
I guess you could call that first one metabolism. Sometimes it's beyond metabolism. There's lots of other underlying causes, but metabolism can certainly be part of one of those underlying causes.
Take me back, I guess, to when you were thinking about investing in a body composition analyzer. What was going through your mind at that point, and why did you choose InBody?
Yeah, so it was the very first thing I actually bought because I was so interested in the technology. And I had actually a little bit of a personal experience, which is around the time that I discovered InBody, I had started CrossFit. So I was doing this obesity rotation. And as part of that rotation, I did an InBody scan on myself and got to experience what the technology was like. And I was like, oh, that's kind of cool. But when you do just one scan, it's just one piece of information, right? And then I started doing CrossFit, and the number on the scale kept going up. And I knew that I was fitter. I knew I was putting muscle on, but as a woman, I'll admit it was a little uncomfortable for me for the first time in my life to see this scale going up and going up and going up. And I had the opportunity to do another InBody test. And lo and behold, I had gained like 8 pounds of muscle and lost like 3 pounds of fat. And that to me was really powerful to see that, I really had put on muscle, quite a bit of muscle for me, and that I'd also lost body fat. And so I became very interested in this technology because it's so much more powerful than the scale, right? The scale doesn't tell you anything about your muscle mass. It doesn't tell you anything about your body fat. And you could weigh, 150 pounds, and that could look very different throughout your life, right? You could be, the fittest you've ever been at 150 pounds, or it could be the day after you've had a baby and you're 150 pounds, right? Like, so it's a number on a scale. It doesn't tell you about water weight. It doesn't tell you anything else. So, I've always been very focused on treating weight to improve health. And so when we have this data that lets us look and say, are we improving health? What's your muscle mass look like? What's your body fat percentage look like? That is so much more useful than what a scale can tell anyone. And so I'll tell you why I picked InBody too. So the conference I think it was still the American Society of Bariatric Physicians back then, and there was a bunch of different body composition opportunities you could try out at this conference. A lot of companies that I'm not even sure exist anymore. And so I tried them all out. I'd already experienced InBody, but I tried all the other ones. And one of the things that was very bothersome about a lot of the devices is they were kind of just guessing. You would put a lot of input into the machine. I remember one machine asked me how much I worked out a week, and the option was less than 8 hours or more than 8 hours a week. And I was like right on the cusp of 8 hours. So I did it both ways. And my body fat percentage changed by like 5 percentage points just based on what I told the machine. And so I didn't find that to be I was like, it's just guessing. When I told it I worked out more, it's saying I had more muscle mass. That for me wasn't a very helpful tool. So looking at how InBody used more pure data, it wasn't, guessing, it wasn't projecting based on my gender, my age, what I said my activity level was a big part of why I chose personally to invest in InBody.
Yeah, there's a lot of companies out there that we see them pop up and they disappear just as fast as they came. And I think because they do rely more heavily on those estimations where they have to guess because they're not getting full measurements of the body. And one of our unique differences is that we are measuring the whole body at multiple frequencies of intensity. So lower frequencies travel through the extracellular tissue and higher frequencies go through the intracellular tissue. And we've enabled ourselves to eliminate the use of any type of preloaded data based on any of those things like activity or ethnicity or gender or things like that. One of the things that you said that I think would be valuable for our listeners to understand more about maybe how you've learned how to address this, and you mentioned it when you first tested at the CrossFit, maybe there was a little insecurity there about your weight or different things like that. How have you kind of grown to work with women or even men who have, hesitation stepping on the scale to help them understand that it's a tool that can continue to help them?
Yeah, I number one, respect where people are at. So there are often people who the first visits with me, they don't want to get on a scale. They don't want to see a number. For me to be able to do what I do and prescribe medications, I really do, need that objective information in some way. But if people aren't ready, it can be very emotional to see specific numbers, even if that is something like body fat versus a weight. And so a lot of times we will have people, weigh backwards on our machines or weigh with their eye closed, or we'll cover the number so that the patient doesn't have to see that number until they're ready for it. And there are some people who, when I'm first working with them, they just don't want to know specific numbers for a while, and they just trust me if things are going the right direction. And so we'll just talk about it in more general terms. But one of my goals for most of my patients is that they do get more comfortable with these numbers, and that they learn to treat them just as numbers. Meaning, if the scale says you're 150 pounds, then that's just a number, right? And sometimes I'll compare it to, I get a lot of other numbers in my clinic, right? We get electrolytes, we get blood sugar numbers, we get numbers about your kidney and your liver. And it's pretty rare that one of my patients takes any of those other numbers personally. And so I try to, kind of jokingly say like, oh, I've never seen someone that worried about their potassium before, right? It's just a number. And so part of what I'm doing when I consult with someone is figuring out, is that number a problem or not? So I'm going to figure out if your potassium's a problem or not. And I'm going to help you figure out if your weight, if your body fat percentage is a problem for you, and then we're going to address it. But early in my career, there was this trend to, not have people weigh themselves because, of all that judgment and shame and bias and trauma that can be associated with the scale for people. And what I saw for most of my patients who wouldn't weigh themselves, didn't want to know a number, is that they would actually continue to gain weight. And most of them ended up with more and more troubles with obesity and more problems related to that. And so I think there's a fine line between, being in denial about real numbers and being like overly obsessed with them. And if that is someone who's struggling with that, hopefully they find a clinician like me or someone else, a therapist who can help support them through that. I think the nice thing with the InBody is, or, body composition in general, is it gives us more information. And so sometimes people come in and we do the InBody scale. It's actually pretty common that people will come in and we see that they have like a lot of muscle mass. And so we can turn that into a positive thing too, or like, look at the results here. Like, you have a lot of muscle. You may never be, quote, normal on the BMI chart, right? You're never going to have a BMI of 24. And that's okay because you're super muscular, right? You're super strong and you have lots of muscle mass, and we don't want you to lose that. But let's look instead at this body fat percentage number, and let's see if we can bring this down to a healthier range. And then we don't have to worry about BMI. Then we don't have to worry about the weight. We can really look at these more objective pieces of information of muscle mass, lean mass, of body fat to really see. And then we're also using that information together with, things like blood work, genetics, how someone is feeling to really determine what their individual goals are.
Tell me more about your customer's journey or your patient's journey. They come in, you get a baseline measurement for them. How frequently you're testing them, and how does that conversation around the body composition evolve over that patient's journey?
Yeah. I do like getting it initially as a baseline, and it also can help me make the diagnosis of obesity. So in our patients that have lower muscle mass, lower lean mass, and sometimes even sarcopenia where they're too low, we will see people who their BMI is technically normal or just a little bit above normal, but when we look at their body fat percentage, they do have obesity. So for me, it has also become an important part of diagnosis because BMI, it's still the current standard, but it really is not the only way to diagnose or really the best way to diagnose obesity. So I use it as part of our diagnostic tools when we're consulting with someone. And then follow up is going to be patient specific. I do think it's great to get an InBody about every 12 weeks for the sort of work that I'm doing. I have some patients who love the technology and they want it every month. Sometimes if we do it too soon, then we don't see as much change. For some patients, that can be frustrating. But some patients like all the data and they're able to see the big picture and they can appreciate some of those smaller changes as well. So, I think we tend to do it about every 12 weeks or so in our practice. But there's some people who they don't like it. They don't want to get too caught up in any of the numbers and they don't do it, or they do a lot of telehealth with us. But in an ideal world, we're doing that about every 12 weeks in our clinic.
You mentioned sarcopenia, and I wanted to highlight that on our newer models, we show a score called SMI, which is a skeletal muscle index that divides the amount of lean mass in your arms and your legs by your height. So kind of like your BMI would show a height to weight ratio, the SMI is lean mass over height. So it's a good indicator of sarcopenia for one. And then we also just released a new product within the last few months called an InGrip, which is a hand strength dynamometer, where we talk about how the body composition analyzer is going to show us the quantity of muscle that you have, and the grip strength is going to show us the quality of that muscle. And we're able to help identify that risk as well. And it integrates into the body composition analyzer, so you can have those results also print out on the results sheet itself. You said that the body composition analyzer can help you diagnose obesity. And I was curious how you define obesity, and is it more than just somebody's weight, and does it include other types of parameters? Perhaps as we've grown in our understanding of managing obesity, does it have a broader definition of things like sarcopenia or other things?
Yeah, I think there's kind of two components to that. One is I always like to figure out how much someone's weight is affecting them and their health. So I think that's one component of it. But BMI is sort of the current standard, but other ways that we can, diagnose obesity would be body fat percentage, and then waist circumference. So those are all things. And sometimes if you use BMI and say the InBody and waist circumference, someone will meet the criteria for obesity on like two of those, right? So maybe their waist circumference and the InBody both show obesity, but their BMI is only 26. So there's that. But I think ultimately all of those are still numbers, right? So some of this is where someone came from. So even if someone has a body fat percentage that puts them into the obesity category, but they've already lost maybe 30 pounds and they're feeling really fit. They're working out most days. They're able to do all the activities they want and their blood work looks great. That may not be obesity we need to treat, right? So I think that's another component of this too is there's no one number that to me as a physician tells me you need to lose weight, right? We're really looking at the whole person and is there a health benefit to losing weight? Because losing weight's really hard to do. And there's consequences that go along with that, right? You may have to take a medication. You may have to be on a really strict diet. You may have to take a supplement. Like there may be things you're having to do. And so is it worth doing those things or not is a big part of what I'm trying to figure out as a physician.
In all of your experience looking at the body composition scores alongside of blood work, do you see any similarities, or does the body composition in ways help simplify some of the blood work or relate to it in any ways?
I think ultimately, no, right? We'll see people who come in and they may have a really high body fat percentage, but their blood work looks perfect. Vice versa, we'll have people who maybe they're barely in that, too high of body fat percentage category. Maybe it's a woman who's, body fat percentage like 32%, but their blood work looks terrible. They have really high cholesterol and they have high blood sugar. The skeletal muscle mass is probably one of the bigger predictors there. So the people who really don't have enough lean mass, they're metabolically often not as healthy. So your skeletal muscle really is helpful in dealing with insulin and blood sugar. And if you don't have very much lean mass and you're also not exercising very much, and that's part of why you don't have very much lean mass, then that would probably correlate the most with blood work that doesn't look ideal. But it's really why we need all the pieces because, again, someone numbers can look really concerning on the InBody, but then their blood work looks great. And so, there's not always a correlation there.
Let's talk about value that InBody has brought into your practice. When I think about like return on investment, a lot of times it comes in a direct way where people are accepting cash in their hand for somebody doing a test. And a lot of other times, especially in medical clinics, it's more indirect where it's a value add to the program. What does that look like for you since you've brought the InBody in?
Yeah. Well, I like a direct return on my investment in a lot of cases. So what I actually did with my InBody when I first got it is I went to CrossFit gyms and I did before and after challenges. And that was really fun. And it was a good way to get a quick return on investment for my InBody. But in the clinical setting, I think that it really does help add to a comprehensive obesity care program. Again, it's helping me make my diagnosis. So there's some people who come in, if all I had was a scale, I wouldn't be able to make that diagnosis of obesity for them. And then I wouldn't be able to qualify them for a medication. And so it does really help me with that clinical decision making and open up the opportunity to do more aggressive treatment strategies like medication for some of my patients. And then I think it also helps patients get a much better understanding of what is going on with their body, especially, because I encourage strength training and resistance training. I will often see people who are putting lean mass on while they're losing body fat, and the scale will never tell you that. The scale won't change. But the InBody is. And so again, that's where this is so much more powerful than just a scale because you could gain 5 pounds of muscle and lose 5 pounds of fat. A scale won't tell you that, but the InBody will. And so it does help with my patients buying into their treatment and seeing that their treatment is working as well. And then what some clinicians do if they are doing like traditional insurance billing, which is a lot of what we do in our clinic, is they include the interpretation of an InBody as part of their medical decision making. So the way we bill is we're kind of like scoring, how much work or how much thought we had to put into the patient. And so medical decision making, like interpreting the results of an InBody would count towards the complexity of a visit.
Fantastic. I love how you brought up that you were using it in wellness challenges, and I think that's a pretty popular way for people to think about it. If they can kind of put together a program where they can show up and test everybody in and test everybody out, and you could do that in a lot of different places, a CrossFit gym or any other type of business that would have you in. Typically have budgets for type of things like that, where you could also include it alongside of like educational seminars. Now that you've tested everybody, you can teach them about what you've got going on. And it's a way for you to reach out into the community and maybe drive some traffic back into your business for people maybe that just want to pay per test, or, a bundle of tests, or they join a program that you have and it's included in that value. But overall, it's a great way to attract new members, help convert them into your programs, and then even retain them longer as they continue on with your programs.
Absolutely.
Tell me more about GLP-1s.
Oh, yes. Well,
What's your
we
experience
could
been
talk
like
about
with
that all
that?
day. So GLP-1 receptor agonists, are medications. The two main ones right now are Wegovy and Zepbound. A lot of times people lump Ozempic in there. That's a diabetes one. But these medications have been out for more than a decade, but they really just got approval to have these more powerful ones for weight loss over the last 3 years or so. And they really have just transformed the field of obesity medicine. The first way they've done that is people know we exist. When I 10 years ago told people that I was an obesity physician, no one knew what that was or what I was doing. But now the fact that there are medical interventions to help people with weight are really commonplace. So that's been a really huge thing. But more importantly, these medications are, for most people, incredibly safe and incredibly effective. So that's part of why they've just taken the world by storm. When we look at Wegovy, it has about a 15% average weight loss. When we look at Zepbound, it has up to a 20% average weight loss. And that's just minimal lifestyle interventions, just watching calories, moving a little bit more. We can get even more impressive results in a clinic like ours, where we do much more comprehensive care. So that's part of why people have heard so much about these medications, because they really have transformed that. In relation to body composition, it has made me use my InBody more than ever, because we want to do a couple things with this. Number one, we want to qualify people for medications if they do have obesity, and the machine does help me broaden, that diagnosis. But it also really helps me track people's results. So we can look at water weight, make sure people aren't dehydrated. I had one patient who came in on the medication and she was just feeling really, really terrible. And I compared her InBodies and I was able to look at some of her water scores and see that she was really dehydrated. And so we kind of changed our treatment plan with the medication to help her stay more hydrated, and she felt so much better, right? But more commonly, what I'm looking at is to make sure people are maintaining their lean mass while losing body fat. For some people, they come in with a lot of lean mass, and so that's less of an issue. But for some people, they, barely have enough. They have average lean mass or below average lean muscle mass. And we want to make sure that they are at least maintaining that, if not potentially increasing that while losing weight on the medication. So it's been more powerful than ever for us to be able to track that information with the InBody.
And you also have a fitness program that goes along with it.
Yes. So,
Perhaps, I was going to say,
so
perhaps to
we,
like help with.
there is a very real concern about lean mass being lost on these medications. We haven't seen it very much in our clinic because we counsel patients on how much protein to get and really emphasize that they get enough protein on these medications. And then we also counsel and even sometimes train our patients ourselves with resistance training. And so I really saw that this was a big problem for people who maybe were getting medication in clinics where their doctor didn't have that much time to spend with them. And so along with my CrossFit colleagues, we created a program called GLP Strong. And GLP Strong is a twice a week home workout. It's focused on resistance training, focused on full body movements to really help at least maintain your muscle mass, if not increase your muscle mass while you are on a GLP medication. So it's designed to be incredibly straightforward, home program, only about 20 minutes twice a week, really focused on improving that lean mass for people who are on medications. And that's glpstrong.com. You can find that. And I will be rolling out some new GLP Strong tools in the next few months beyond just the strength training. There will be a guidebook soon to help support people on their medications, as well as a course that people can take to help really have the most success possible on their GLP medication journey.
Can you talk to me more about how nutrition fits into your program and how important the basal metabolic rate is?
So the basal metabolic rate can be a helpful tool. I find it most helpful in the initial consultation with kind of creating a reality check for patients of what a basal metabolic rate is, meaning, this is just how many calories you would burn if you were laying in bed doing nothing all day, right? How much does it take to just run your body versus how much are you really burning from exercise? People really don't understand that the vast majority of calories most of us are burning in a day, unless we're endurance athletes, and we're training 4 or 5 hours at a time. Most our calories are basal metabolic rate. And so, if you get an extra couple 100 calories from working out, great. But most of the time, really, it is that basal metabolic rate. And this is really helpful, especially for my smaller patients or my older patients, to see how low that basal metabolic rate really is, right? So when I see a 65-year-old postmenopausal woman who's like 5'1", we look at that basal metabolic rate and it's like, 1,600 calories a day. No wonder it's hard to lose weight, right? You can get one Chipotle burrito and that's all your calories for the day. So it is helpful in that context. I do think that, we have to take that number with some degree of a grain of salt, because we know that when people are losing weight, when they're metabolically losing weight, that most of their metabolic rates will actually slow down. So it can be an overestimate because the InBodies is using body composition. If you have someone who's actively losing weight or has already lost a lot of weight, it can be an overestimate. So I like it as that baseline to kind of set context. But I just tend to be someone who's not married to specific numbers with my treatment. So I don't obsess about every calorie patients are eating or every macronutrient someone's eating. I find that that's a really exhausting way for most people to go through their life. And so we try to come up with a little bit more general nutrition plans for people as opposed to micromanaging calories.
Top 3 to 5 nutrition tips you give your customers or your patients?
So I just finished recording a big medical weight loss summit. Bradley was generous enough to guest on that. And the biggest tip that I came home with from interviewing 40 different experts, was the most consensus nutrition-wise was to eat less ultra-processed food. So eat more real food. Whether you're a plant-based person or not, eat more real food, right? That was like the biggest consistent thing, meaning don't eat too much of the ultra-processed things, the chips, the crackers, the cookies, the things you could never replicate in your own home. So that was the most universal thing. I always say eat more vegetables. That is pretty safe advice for most people. Vegetables are good for our health. They have lots of fiber and they are not very calorically dense. You can eat a giant clamshell full of spinach and it's like 100 calories, right? So you get a lot of volume for not very many calories, and then tons of nutrition, tons of micronutrients and other benefits in those veggies. So that would be my second tip. And then my third tip for nutrition is not to be too black and white about nutrition, which is I want to live my life where I can have a piece of cake at a birthday party, and I want my patients to feel that way too. So we shouldn't be so restrictive that we can't live our lives. So focus on eating more vegetables, eat less ultra processed food. But if you have to be so strict that you can't live your life, for most of my patients, that backfires eventually and they give up and they're either eating nothing but junk or they're eating nothing but health food. And I really want my patients to find a path in between where you can have the piece of cake at a birthday party without feeling stressed out.
If you had the piece of cake at the birthday party, is there any type of recommendation that you would follow that up with?
Enjoy it and move on, right? Don't bring all the cake home with you. Don't keep it on your counter where now you're eating cake every day for the rest of the week. Try not to have a second piece. Slow down, enjoy the piece of cake without guilt, without shame, and then move on.
Fantastic. Let's take it back to InBody one more time and share with me what type of advice would you offer a doctor or maybe even a gym, somebody just getting started with InBody, maybe like some hacks or growth accelerators or secrets that you've learned over time?
I think play around with the machine. I had so much fun when I first got it. I'm trying different things out, seeing what differences would happen if I used the wipes or didn't, seeing what my scan looked like throughout different times of the day, looking at what my scan looked like before or after a workout. So when you play around with it for yourself, then you really get to see how different variations can affect it. And you start to see all these little subtle differences, right? So you really get to see how precise the technology is. So I would say just play around with it, experiment with on yourself. If there's staff in your office who are interested and want to play around with it, you'll really better understand the technology if you use it for yourself in a lot of different contexts and see how different things affect it.
That's a fantastic recommendation. And I think it has to be part of the learning curve for somebody being able to apply it to their business, especially for the entire staff to be able to speak effectively on the product or answer questions about the results over time too. Tell me more about the Dr. Carolynn Francavilla podcast.
Yeah, so the
What's that
Dr.
experience
Francavilla
been like?
Show is my podcast. It's real conversations about health and weight. So all my top pearls, things that I talk about with my patients end up on there. I have guest colleagues, physicians, and other health professionals from all over the country who come in with their expertise and share top tips with patients. So if you can't come see me in person at my clinic in Colorado, it is the next best thing you can do to listen to the podcast, the Dr. Francavilla Show.
Anything else that you want to share that we haven't talked about yet? Kind of
For
open
any
invitation to.
healthcare providers you have that are listening, I do have materials that help physicians, NPs, PAs get involved in treating obesity. And that's at my website, helpyourpatientsloseWeight.com. I have a 13-hour course that is everything I've developed over the last 10 years in my clinic so that you can jumpstart practicing obesity medicine. I have some mini courses there that are shorter and business support as well. So if you're trying to figure out how to grow an obesity medicine practice, Help Your Patients Lose Weight is the place to go check out.
Anything else you want to share?
I think that's it. Thank you so much for letting me share all that.
Cool. Well, thank you so much for joining me today. If you are listening and you're a provider and you want to learn more about InBody and a special offer from this podcast, you can go to inbodyusa.com/beyond the scale. And if you want to connect with Dr. Francavilla, we're going to put all those links in the show notes. And I sincerely appreciate you coming here to share your wisdom with us, and hope you have a great day.